we ready?
Yeah.
Okay.
Come in.
Hi, my name is Tammy. I'm going to be your nurse today. Is it okay if my instructor is here in the room with us?
Yes.
Okay, great. Can you please tell me your name and date of birth?
It's Crystal Juarez, and it's September 8th, 2003.
Okay, and I checked that. That's great. What gender do you identify with?
Female?
Okay. I am going to give you some privacy and do some hand hygiene. Okay. Can you tell me your height and weight? You can look at that one.
Yeah, it's 52 kilograms, and I'm 167 meters. Well,
Okay.
centimeters. Yeah.
Good. Okay. Also, do you have any allergies?
No. Where do you want the allergies from?
Yeah, just read it. You're fine.
Sofa.
Okay. And what's your reaction to that? Just make one up.
I get hives.
You get hives.
Mm.
Okay. Can you tell me why you're here today?
I have a really bad headache.
Okay.
And I'm throwing up.
Okay, well, I'm sorry about that. We'll talk about that in a minute. Do you have any other diagnoses we need to realize or think about?
No.
Nope, you're good?
Mhm.
Okay. I see that they took your vitals before you came in. It says here that your blood pressure is 116/68. Your heart rate is 60. Your respiratory rate is 14. Your O2 sats are 98% on room air, and your temperature is 37.0 Celsius. Okay, let's talk about your pain a little bit. Where's that pain located, you said?
In my head.
In your head, what side?
Probably like the left side.
The left side. Okay, when did that start?
This morning.
This morning? How long have you had that pain? Just since this morning only?
Yeah.
Okay, that is an acute pain. How often are you feeling it? Is it constant? Is it like off and on?
Yeah, like off and on.
Off and on? Anything make it worse?
Just like loud noises.
Okay, anything to make it better?
Cold water.
Cold water. Okay, on a scale of 0 to 10, 0 being no pain, 10 being the worst pain you can imagine, what is your pain right now?
Like a 5.
Like a 5. Okay. On that same scale, what could we get that to make it tolerable for you?
Like a 2.
A 2. Okay. And what does it feel like to you? Is it achy? Is it throbbing? Is it sharp?
Yeah, it's throbbing.
Throbbing? Okay, we'll let the doctor know about that. Next. Are you having any pain today?
No.
Okay. On a scale from 0 to 10, 0 being no pain, 10 being the worst pain, what would you rate that?
0.
0? Okay. Do you want to keep that as your goal?
Yep.
Okay, perfect. Thank you. Okay, just some other questions I have for you. You've already told me your name. Can you tell me where you are?
I'm at the hospital.
Okay, can you tell me what day it is?
It's 4:20.
Okay, perfect. And you already said that your situation was that you were here for a headache. Okay, so you're oriented ×4. Can I have you please squeeze my fingers? Great, grip strength is equal bilaterally and patient can follow commands. Speech is also clear and understandable. Okay, and I'm going to put Perla in with HENT. Okay, just some other questions. Are you having any stressors today?
No, just school.
To school, like an assessment you have to do? Yeah. What are you doing to cope with that?
Just biting my nails.
Okay. Well, everybody has their own thing. Okay. What is your mood today?
Excited.
Good. Your affect matches your mood. On a scale, I'm sorry. That's not what I wanted to ask. Are you having any thoughts of harming yourself or others?
No.
No? Okay, that's good. I'm going to start out with my physical assessment now. Okay? And so do I have permission to touch you?
Yes.
Okay, great. I'm gonna touch your head here. Hair is evenly distributed. Scalp. Any pain with that?
No.
No pain. Okay, and things look normal cephalic. I'm gonna come down to your neck. Any pain?
No.
Okay, and trachea is midline. I do not feel any swollen glands here. Okay, I'm gonna take out my pen light here, and I'm gonna look in your ears. No redness or drainage. No redness or drainage. Can you tip your head back? No redness or drainage in the nose. Can you open your mouth for me? Okay, mucous membrane looks nice and moist. Dentition looks appropriate. I'm gonna say that. And I don't see any drainage down the back of the throat. At this point, if you had glasses, I would have you take them off. I'm gonna turn on my pen light. Can you look straight ahead, please? Okay, and then can you look at my nose, look over my shoulder, and look at my nose again. Okay, Perla is intact, which means pupils are equally round, reactive to light, and accommodating. Okay, I'm also going to have you follow my pen. Okay, great. And can you pull down your eyes there? Sclera is white, mucous membranes look nice and moist and pink. Thank you. I'm now going to move to cardiac, and I'm going to listen to your heart sounds. Aortic, pulmonic, herbs, tricuspid, and mitral. I hear S1 and S2, and heart rate is regular. Can I have you turn your hands this way? I'm going to feel pulses. Radial pulses are 2+ equal bilaterally. I'm going to have you flip your hands over. 2, 3, 4, 5. Kappa refill is less than 3 seconds on all fingers. And there is no edema in upper extremities. Now I'm going to come down here. No edema in lower extremities. Kappa refill is less than 3 seconds on all toes. And on pulses, pulses are 2+ and equal bilaterally. There is no IV that I see. Okay, now I'm going to listen to your breath sounds. 1, 2, 3, 4, 5, 6. Can I have you sit forward? 1, 2, 3, 4, 5, 6. Breath sounds are clear in all lobes. Breathing is not labored. Are you having any cough?
No.
Okay, so no sputum coming up. Okay, great. Now I'm going to lay you down, so I'm going to do an abdominal assessment. So go ahead and lay down. Pretend to lift up your shirt. Okay, I'm inspecting. I see slight curve. I don't see any scars or other things, any rashes on the abdomen. I'm now going to listen. 1, 2, 3, 4. I hear vowel sounds in all 4 quadrants. Now I'm going to touch really quick, palpate. Let me know if there's any pain. Any pain across there?
No.
Okay. Okay, I'm going to go ahead and sit you up. There you go. Okay, and just lots of questions. When was your last bowel movement?
Yesterday?
Yesterday. Do you remember that bowel movement? Do you remember what color it was?
Brown.
And what was the consistency? Was it firm, runny?
Firm.
Firm. Okay, and how often do you have bowel movements?
Pretty I'm pretty irregular, like sometimes every day.
Okay, sounds good. Are you having any problems passing gas?
No.
And when you do have a bowel movement, do you make it to the bathroom in time?
Yes.
Okay, what about urine? Do you
Yes.
make it to the bathroom for that?
Mhm.
Okay, how often do you urinate per day?
Like 13 times a day.
Really good hydrated?
Yeah.
Okay, any pain with urination?
No.
Any different odor, strange odor?
No.
And what color was your urine this morning?
Like clear yellow.
Clear yellow. Good. Okay, and I do not see any urinary catheter. Okay. I am going to have you swing your legs over the edge. Okay. Do you use any assistive devices to walk with?
No.
And have you had a fall recently?
No.
Okay. I'm just going to have you follow my movements. I'm going to do range of motion, which means just looking at all your joints, how they move. Okay. So can you move your shoulders around? Can you bend your elbows? Can you roll your wrists and wiggle your fingers for me? Good. Okay, can you do this in front of me? Pull against, push. Good. Range of motion and strength are intact. Now I'm going to go to your lower extremities. Can I have you roll your ankles and lift your legs up? Good. Can I have you wiggle your toes? Great. You can go ahead and put those down. Can you push against my hands out and in? Can you go up with your toes and down? Okay, lower extremity range of motion and strength is intact. I'm going to have you stand up and walk a few steps that way. Turn around and come back. Great, and you're welcome to sit down and put your legs back up. Gait is steady and posture is straight up, erect, midline. Okay, now just a few more things. Can I have your hand? I'm going to look at your skin. Skin is warm, dry, appropriate for ethnicity. And I'm going to check the turgor up here. Turgor recoils quickly, and I see no lines, drains, or wounds. Do you have any? Okay. Okay, that's all of my assessment. Is there anything else I can get for you?
No, thanks.
Okay, here's your call light, and I'll let the doctor know what I find. Thank you. And hi, Jane. Did I miss anything? Are we good? Okay, questions. Questions.
Yes, do we supposed to say bed is at lowest position?